Hello, my name is Beth LaCroix, Summer Vista Associate with Hope Fair Housing Center, the largest and oldest fair housing center in Illinois. Thank you all for being here with us today virtually to commemorate the 31st anniversary of the Americans with Disabilities Act, and more specifically discuss the issue of housing discrimination based on disability. To get us started, I will first begin by quickly overviewing two important and applicable federal laws. The first is the Fair Housing Act, which prohibits housing discrimination based on several protected classes, including race, color, national origin, religion, sex, familial status, and disability. And the next law is the Americans with Disabilities Act, the law we are celebrating, and it provides equal opportunity for individuals with disabilities in public accommodations, employment, transportation, state and local government services, and telecommunications. From a statistical standpoint, housing discrimination is especially common for adults with disabilities. In fact, over half of all housing discrimination complaints filed in 2020 were on the basis of disability discrimination. So there are several ways in which people with disabilities experience housing discrimination, but just to give a few examples, the housing provider refuses to make or allow the individual to make reasonable accommodations or modifications to the property. The housing provider offers unfair terms and conditions for adults with disabilities, or the housing provider refuses to rent or sell the residence to an individual because of their disabilities. Like I mentioned, there are multiple different ways people experience housing discrimination, but those were just a few examples. And today we have an excellent group of knowledgeable people to discuss how prevalent housing discrimination remains against those with disabilities. And it's just a pleasure to have all of them here. So first we have April Redzic, President and CEO of DuPage Pads Shelter and Services. We have Mary Rosenberg, Senior Attorney with Access Living. And we have Evelyn Sanguinetti, Executive Director of Hope Fair Housing Center. Thank you all so much for joining us today.
Thank you for having us.
Yes.
Glad to be here.
So we can go ahead and jump into the first question, which pertains to COVID-19. So as we all know, COVID-19 has presented the world with many unknowns. So I'm wondering, what have you all observed as a byproduct of COVID within your organizations?
Want me to take a stab at the first one?
Be great.
Well, indeed. First of all, thank you very much, Mary and April, for being part of this roundtable today. This is a very important discussion that must be had. When we think about COVID, you would think that the wrongdoers would go dormant, right? Because there was a lot of need during this time, but quite the opposite is true. So here at Hope, I'd like to illustrate that by letting you know the sort of intakes, in other words, callers that were calling in with discrimination complaints. In June, there were a total of 49 intakes, 16 of which resulted in cases of various degrees. But 16 of those intakes reference disability as a protected class. That means that just over 41% of the calls that we received at Hope last month were in some way related to disability as an accepted class, as a protected class. So that, folks, is absolutely unacceptable, particularly now when the need is so high. Also, Hope filed 3 housing discrimination complaints with the U.S. Department of Housing and Urban Development, 2 of which were against a condominium association that retaliated against a unit owner and a tenant for having exercised their fair housing rights via a reasonable accommodation request. So in sum, the need is still very real, and the discrimination based on disability in housing is still, unfortunately, very real.
I think to add to that, I would say that there have been some unique challenges for people with disabilities during COVID. One would be for folks who are living in congregate settings, as we've seen over the COVID pandemic, that folks who are in congregate settings, such as nursing homes or shelters or jails or prisons or other types of facilities for folks with disabilities have been more likely to catch COVID over the time. And so it's been a real wake up to show how important it is that people with disabilities move into the community and are able to leave congregate settings and find, and I know we'll talk about this more later, find it's affordable, accessible housing in the community. And I would say, in addition, the types of cases in terms of accommodations we've gotten during COVID-19 have been a little bit different. We've had some cases related to COVID that involved, for example, people with disabilities wanting to have their personal caretaker come visit, but because at various times during the pandemic, there's been restrictions in some apartment buildings on visitors, that's been an issue sometimes. Sometimes, typically under the Fair Housing Act, you can't ask a person with a disability or person in general about the nature of their disability, but some landlords have started asking folks about their COVID status, questions about their underlying disability, which in our view still violates the Fair Housing Act and really doesn't do much to prevent COVID spreading, right? Like landlords, it made sense for them to put in restrictions, for example, around social distancing, things like that, but to not ask those extra questions that don't really make anybody in the building safer and violate the Fair Housing Act. So those are some ways that COVID specifically has created new discrimination cases.
So for DuPage pads, COVID has created challenges in two different areas. One is we have permanent supportive housing apartments for people with disabilities, and that's about 120 adults plus 30 of their children. And we've seen isolation. We have seen difficulty in the ability to access care in a way that they feel safe. For clients who've had mental health related disabilities, I'll be honest with you, I have good news there. More than we've seen in past years have chosen to receive additional therapeutic services because they were isolated, they were alone, and telehealth has been a benefit there. So I do want to share a silver lining, because what we see oftentimes in times like this is the other half. On the other half, however, we have seen people with disabilities come in and need emergency shelter. And so we're housing about 200 people each night through hotel-based emergency shelter. About a third of those are children, but quite a few of them have come in with some serious either physical or learning disabilities, and they need help. So we do see it as a really, really relevant issue, and one that I'm glad we're spending some time talking about today.
Awesome. And going off of that question a little bit, how does the eviction moratorium play into this? And has the eviction moratorium provided any help at all?
This is Mary. I think it definitely has provided a lot of help for folks who have maybe lost a job during COVID or had some other issue where they haven't been able to have housing stability. Having that eviction moratorium has really helped people remain housed, obviously, but also help stem the tide of the pandemic. You know, if a lot of the folks who lost a job maybe and can't pay their rent end up homeless or experiencing homelessness, that'll certainly increase the number of cases we have around COVID-19. So it's helped in that way, but definitely that's been an important tool during the last year to help folks remain safe and healthy.
Yeah, I would echo that, Mary. The eviction moratorium has provided a lot of much needed help, but at the same time, we have to remember that all things come to an end, and that includes the eviction moratorium. And it's coming to an end very soon. So Illinois plans to phase out its moratorium on evictions starting in August, and it will be coinciding with the federal ban, which ends in July 31st of 2021. So the problems are right around the corner. I mean, what's going to happen to people during that time where eviction moratorium ends? And also, too, I'd like to remind everyone that even though there was an eviction moratorium in place at the state level and at the federal level, nothing prohibited landlords from looking to evict people, and they could still do it on grounds that people presented a danger to themselves, the property, or others. And that would include our community facing a mental health crisis, for instance. And we're seeing it a lot right now with all the isolation that we've just spoken about. And so those experiencing a mental health crisis, despite the eviction moratorium, landlords were still free to go and evict those individuals. And we need to think about that because it's very real. And our community with mental health issues needs a place to go. And with the things as they stand right now, people with mental health disabilities do not have that.
I would agree. There's still a stigma. We see that HUD did a study on this in 2017 on the other side, which is on the application side. And they found that people who have a mental health disability were half as likely to receive a return call from a landlord because and so if you look at those numbers and what that can mean for people who are looking to have a place to stay, it can be very challenging. And we see that sometimes as we're looking to advocate for people to get into housing. Even when we have the financial supports to make it possible, you still need a landlord who's willing to work with you on that.
I guess the other thing I would underscore is, we do get a lot of cases of folks with psychiatric disabilities who are perceived as a threat to themselves or others, but because of acting differently or a little differently than expected, but aren't in fact a threat to themselves or others. And so, as we get those kind of cases, it's important to evaluate a direct threat is supposed to be an individualized assessment of that person and the behavior and whether that behavior constitutes a threat. And so it's just important to be very critical of those kind of cases because there's such a huge stigma that people with psychiatric disabilities may be dangerous when that's often not the case.
Good point.
We are also doing everything for folks who may be watching this. We are also doing everything we can to make sure people are aware that with the eviction moratorium, if you may be at risk for becoming homeless, please stay where you are and then seek help. Don't leave and then seek help because you may be better off from a legal standpoint that way. And there are resources in the community, folks like Mary, Prairie State, who will help you to advocate for yourself, provided you're staying where you are.
Awesome. Thank you for that. And moving on to our third question, going into accessible housing for people with disabilities. We all know the importance of shelter and housing and what it can mean to an individual. But what does an accessible home mean for a person with disabilities, one that is inclusive to what they need and can help them, do their daily activities? And how does it contribute to their quality of life?
Well, I love this question because the answer to the question of what does an accessible home mean for people with disabilities, the answer is it depends. It's not a one size fits all. You need to deal with every individual on a case-by-case basis. And I tell you this from experience. So I have multiple sclerosis, and MS warriors will always tell you that once you've met one person with multiple sclerosis, you've only met one person because we all manifest the disease differently. It's a chronic disease that takes away things over time. So for me, all I experience is fatigue. My definition of what accessibility means in the home is very different from other MS warriors that are possibly blind or need assistance walking, and so on. When we take a look at what we do at Hope, recently we rounded off a program. It was a retrofit program where people that could not afford to make their homes accessible applied for a grant through us. And I could tell you the stories of what an accessible home means to different people that have come to us. There was a couple, for instance, that could not make it. The wife could not make it to the bathroom upstairs. It was not accessible. And so her husband was helping her in the kitchen daily to take sponge baths. Now, is that a way to live? It's not. And so another person that was part of our retrofit program was in a wheelchair at home, and he couldn't get out of his home because he did not have a ramp. And so for him, accessibility meant a ramp so that he could have access to the outside world. So again, it depends.
I would add to what Evelyn said to say that housing is really a fundamental and primary need for people with disabilities in particular. The number one thing we get calls about at Access Living by far is people searching for affordable, accessible housing. And really both of those parts are important. You know, people with disabilities are disproportionately unemployed or underemployed because of all different systemic barriers that people with disabilities face towards employment. And for that reason, people often need accessibility features. As Evelyn said, she's absolutely right. What those features are vary from person to person. But also often people with disabilities need some sort of subsidy in order to be able to live in the community. And really the lack of those two things. So like there was a study around accessibility nationally, and I want to say it was something like 5% of housing stock in the United States is accessible to people with moderate physical disabilities, and 1% was accessible to folks who use a wheelchair. So you can see really how scarce it is just to find accessible housing, and then adding that subsidy to it. You know, vouchers are scarce. Permanent supportive housing, as April was talking about, is very hard to get into. There's so much greater need than there is availability of those types of programs, so that, you know, it's really a critical need. And, you know, often when folks with disabilities can't find that affordable, accessible housing, it really will end up with folks being either to experience homelessness or ending up back in institutions. Like that is the thing that keeps folks in institutions and out of the community versus in the community, which is, you know, such an important part of life, right? Is to be able to, you know, do what you want and live in the community and that kind of thing. So I would just add that to what Evelyn's comments. Yeah.
The other half to this that we're talking about, if for you to have a quality place to live, you have to have a quality place to live, and that affects your health in general. If you don't have a home, not only is your well-being emotionally affected, but your physical health is affected. You can't care for yourself if you do not have a place to stay. And we say that often in our client population. If you utilize medicine, if you need medicine to keep yourself well, if you do not have a place to store that medicine, your ability to take it and retain it is going to be severely limited. If you have a loss of a limb and you are trying to get around without your own place, your mobility and your ability to function is really low from a moving from place to place standpoint. Living in a car is not a great way to function. And we do still see people in our community who are living at that level and need more options. And on the option side, it has to be affordable. And it has to be affordable in a place where you can get to services. If it's only affordable for you to live in a place that is not near your hospital, that is not near where you can access care, you're not going to be able to thrive. And I think that's really important for us to think about is not only affordable housing, but affordable housing in areas where you can get to services and have a good quality of life.
And we briefly earlier, I touched on two important federal laws pertaining to people with disabilities, the Americans with Disabilities Act and the Fair Housing Act. We know these are two significant pieces of legislation that have both worked together to make life more inclusive for millions of Americans, but there is obviously still a problem and there's still more work to be done. So, where do we go from here, and what are some of the next steps needed to be taken to include more people with disabilities in the community?
So I kind of had two thoughts when thinking about this question. One is thinking about how the ADA and the Fair Housing Act have both existed for roughly 30 years now. And what's one thing that's really needed is enforcement of both of them. Laws exist, but unless there's folks to enforce them, they don't achieve a lot, right? And so, for example, Access Living currently has a lawsuit against the city of Chicago for failing to build accessible housing according to the Fair Housing Act and Section 504, which is another disability discrimination law, for the past 30 years, so that people with disabilities don't have access to the affordable housing that the city of Chicago provides the same way that their non-disabled counterparts would. We also have a lawsuit in the city of Chicago, but for failure to have an accessible shelter system. So people with disabilities who have mobility disabilities often can't get into shelters because they aren't accessible. And getting into the shelters is how folks can often access other types of rapid rehousing, permanent supportive housing, other sort of more long-term housing options. So it's another barrier to folks getting real housing stability. So I would say enforcement is really important. And then let's see. I think the other thing is, both the Fair Housing Act and the ADA are a floor, right? Not a ceiling, right? Like, even if we get to a point which we're, far from where folks with disabilities can get into every building, right? Or can ask for an accommodation and, receive it readily, or modification in housing. There's still a real a consciousness change that has to happen before people with disabilities are really accepted into society. There's a lot of stigma. We talked about that regarding folks with mental illness, but regarding all different types of disabilities, there's certainly a stigma issue and also just a real inclusion issue so that folks are included into all different facets of society, not just being able to access housing, which we're not there yet, but once we reach there, the next step is to being really, included in all different facets of society. Yeah.
I would add to that, Mary, is we have come a long way. But based upon our conversation today and knowing all of the intakes, for instance, that we took at Hope just in June alone, we still have a super, super long way to go. So if I were to think about things that we could do, where we could go from here, I think about a movement that I believe the three of us on this panel are involved in. And it's to support policies that help people with disabilities. And one is House Bill 2775, for instance. That bill, if it becomes law, it will outlaw source of income discrimination against those with disabilities, making it that landlords will no longer be able to turn away people because the applicant receives disability benefits. That is huge, and that protects these communities. So an answer to where to go from here is let's stand behind policies that help these communities so that we could grow out of it.
I also think education, so people know how they can advocate for themselves, is a really key thing. And that's not only for people. I don't think we need to leave this onus on people with disabilities. I think we need to make sure the community at large is aware of how they can support this. Access Living has actually been a fantastic partner to DuPage PADS in this, as we've trained our caseworkers in ways that we can help our clients advocate for themselves. But if you don't know what the laws are, and you don't know when something is happening to you that is in fact illegal or unfair, you can't take action. So some education, and I applaud Evelyn and you, Beth, for putting this together today, because I think this is really important if we're going to not only celebrate the work that has been done, but also make sure that we can continue that battle.
And I think another thing I would add is looking to situations where stigma is prevalent and trying to speak up in those situations. One that strikes me that's in Hope's service area is, Haymarket's effort to build a recovery home in DuPage County, right, has been met with a lot of opposition around stereotypes around people in recovery that, and I think, when things come through where it's something that's such a big need for folks, there's such a need given the opioid epidemic, for recovery treatment. And it's just really important when things like that come up to be able to, say to folks when it comes up that those are really based on stereotypes and not on, the reality of what a treatment center like that might do for folks in DuPage County.
Awesome. And our last question for today pertains to technology. So we know over the past few years, technology has had a huge impact on all of our lives. And it's also had a seemingly huge impact, positive impact on people with disabilities. And so do you think that there is a possibility of decreased housing discrimination complaints on the basis of disability in the future due to these technological advancements? And how do you see technology interplay into the lives of people with disabilities?
Yeah, so we're becoming more aware of where inequities lie in this particular space. So for example, inaccessible websites, for instance, they can prevent people with disabilities from accessing information in the same way that their counterparts without disabilities do. Therefore, ADA lawsuits in this regard have gained tremendous prominence. You're seeing that a lot now. And recently, the Ninth Circuit ruled that Domino's website and its pizza ordering mobile app must be accessible to blind customers using screen readers. Further, website inaccessibility prevents many people with disabilities from even finding housing in the first place. So I think that we're becoming more aware about where the unfairness lies in this particular space.
This is Mary. I mean, I'll be the Grinch of the group, and I'll say, no, I don't think technology is going to help that much for people with disabilities. And the reason I would say, I don't think it's going to make a big step forward in some ways. I mean, yes, it makes accessibility for folks who are blind and stuff. That's certainly true. But I think looking at the population of people with disabilities, again, because of the poverty a lot of people with disabilities in, it's really hard for them to access technology. And that has become very clear over the pandemic. At Access Living, we've really had to go the extra mile to try to keep our organizing groups and support groups and the like together, because so many folks struggle with technology, both having technology and then having technological literacy to be able to use those types of devices. I also think that in housing, sometimes technology is used to read out protected classes. So for example, landlords sometimes will use programs to determine who can rent at a particular property, and the algorithms used in those programs often read out people of color and people with disabilities and other marginalized groups. So I'll be the naysayer in this group and say, no, I don't think so.
I was asked by a very well-meaning and wonderful community partner last week whether a text for help phone number would help those in our care. And my response was, well, they have to have a phone. And I think sometimes when we're talking about people, especially people who are housing vulnerable or don't have housing, that's usually an indicator of poverty. So assuming that they have access to the same things is not necessarily the case. And so what we'll do is work with libraries or to try and provide other resources or allow them to come in person to seek access. But again, if you have mobility challenges, that is very difficult. And so I think we need to do more or think more about that as a community if we are going to give people the equal access we're talking about today. And some of that comes down to enough financial supports or ability to get people what they would need for that tech access.
I've also seen it with folks who have vouchers. Often, like public housing authorities will communicate over email to let people know about things they have to do in order to keep their vouchers. And folks will get, or they're on the wait list for some type of public housing, and they'll get kicked off the list because they don't know how to access their email. They forgot the password. They don't have technology to access email and those types of things. And so I think in some ways that that's also a barrier for folks accessing housing.
Or the speed. Sometimes if you don't have a computer, you may not check your email every day.
Right.
And so speed can be a factor if you're all racing for the same space because there are very few spaces available.
Awesome. Well, I believe that completes all of our questions today. So thank you, April, Mary, and Evelyn, so much for joining in and taking part in this important discussion on housing discrimination based on disability. And it can be seen from our conversation that this issue is still extremely prevalent. But we also hope from this conversation that there is gained awareness and acknowledgement of this topic at hand. So thank you again. And for viewers, if you stay on for a brief moment after the call is ended, numbers and emails for each organization, DuPage PADS, Access Living, and Hope Fair Housing Center will all be on the screen. All our resources and amazing organizations that want to help and assist individuals. So give them a call. And again, thank you to all the participants here with us today and all of the viewers watching at home.
Thank you, and happy birthday to the ADA.
Thanks so much.